Look, it's not that we like bringing these stories to you, but I think every time, Natasha, there's another updated story on something going wrong in the healthcare system, we kind of sit here, shake our heads and going, I thought we were on this. I thought this couldn't keep happening. Maybe the difference this time around is we're not talking for a change about the Lakeshore General or about Maison of Rosemont. This time it's about the Royal Vic and what's going on there. Aaron DERFEL, he is the Montreal Gazette health reporter, joins us right now. Aaron, thanks again for being here. I kind of feel like I want to say I wish it was under different circumstances, but again, it's some pretty dire news over the situation there.
Yeah, Aaron, I think what's happening is that, this is probably the aftershocks of the pandemic. We've had 9 waves of the pandemic. There's still 1,000 people who are hospitalized. That's, surprising. Most people think the pandemic is over. And during those 9 waves, there was a lot of burnout. A lot of nurses decided to take early retirement. And then at the same time, there's this backlog of surgeries. So this has hit hospitals hard. And across the province, they've had to close 2,000 beds, in all these various hospitals because they don't have enough nurses. What that means is that because of no beds, you have to carry out fewer surgeries, and it backs up into the emergency room. And so, yes, I wrote about the Lakeshore and then recently about St. Mary's, but now we're seeing it at the Royal Vic, and it's quite bad.
You're making the case for what seems to be a systemic situation, whereas the next domino to fall will be another hospital we haven't talked about up until now. So I guess my question becomes, if we know that the situation has become this, and you're suggesting it has post-pandemic, what are we doing to fix it?
They're trying the best that they can, but there's no easy fix to this. It's a human resources problem. It's a worldwide human resources problem, and we just don't have the staff. So, again, how does it trickle down? It means because you have fewer post-operative beds, you can't do as many surgeries they're trying to do to tackle the backlog, but they still have nearly 160,000 surgeries to clear, and then it ends up in the emergency who should be on a cardiology floor. That's where they should be getting care on a stretcher that doesn't necessarily have all the right equipment, and they're staying in that ER for 3 days. And that gives rise to the potential for complications. Elderly people, the risk of blood clots, developing bed sores, etc., even pneumonia. Something like an inspirometer that you can breathe into if you're on an internal medicine ward, that is a device you can expand your lungs. That reduces the risk of pneumonia. They don't have that in the ER. They don't have an electric power safely in the ER, and the nurses are running from one patient to the other, and so it's.
Aaron, your phone's cutting out, Aaron, on us. Unfortunately,
okay.
We're missing bits and pieces of what you're saying. Can you just move
around?
around?
I'm sorry.
Yeah.
Just move around if you can. I think it's
and then let's pick up on what you were saying, because it's so important. Like, mistakes are going to get made.
Yes, exactly. Because what happens is that the patients should be transferred to a cardiology ward or to an internal medicine ward, and instead they're spending 5 days, sometimes 6 days in the ER, and they're not getting the care that's appropriate to their medical needs. That's where there's a medical risk, and that's in this latest story. That's what I want to emphasize to the public. Most people just think of the ER as being overcrowded, but there's the other side of the coin, which is a potential increase in medical complications, even in some cases death.
As I listen to you go through this and people begin to understand just how serious the problem is, I wonder to myself, when I ask you what can be done and you suggest that it's a human resources problem, it's not like you can flick a switch and add 100 more nurses tomorrow. I understand that. But I wonder what you're hearing from people on the floor, because it seems to me if the situation keeps staying like this, we're simply, never mind adding people, we're going to keep losing people who don't want to be in the system.
And that's why, Aaron, that these sources are coming to me. They're sounding the alarm. One of the things that they could do to improve the situation is doctors could pay more home visits to the elderly. If they do that, they're doing that in Verdun, and that can reduce the prospects of catching something earlier before an older patient winding up in the ER. A more preventive approach. And I've spoken to a couple of people about that who've said that's something that they can do. But really, what the problem that we're facing in Quebec, they're also facing that in Ontario, and they're facing it to some extent in the States. And again, there's just no easy solution in the short term.
Can I ask why the geriatric ward was closed? Is it just simply a staffing shortage?
Well, it was poor medical planning in retrospect. When the old Royal Vic was on University Street downtown, and when they moved to the Glen site, they knew they were going to have fewer beds. So something had to be cut. So they cut the geriatrics division. In retrospect, that was a bad decision because we know the population is aging.
Right. It's kind of a silly question, but as I hear you say that as well, can this be fixed? Maybe that's the question to ask. And if it can, what's the next step?
I think that, I speak about, the question that you're asking me, I speak about this with my sources every day. I think we can build on some small, modest successes, improve safety protocols, more home care involving doctors. We can build on that. And, this is not going to get better in the short term. Like, it's going to get worse before it gets better. I keep repeating that. It's a mantra. And, since we last spoke, right, as I said, it's getting worse at the Royal Vic. Hopefully, maybe things will taper off in the summer. But then the nurses have to go on vacation in the summer. So that's going to create a shortage in of itself. It's just this double whammy of trying to reduce the backlog of surgeries while we're still kind of at the tail end of the pandemic, and you still have 1,000 Quebecers in hospital with COVID. And people want to say, the pandemic is over. But if you still have, as of April 26th, you still had 1,000 patients in the hospital. I don't know how many directly as a result of COVID, but others, they found out they had COVID while they were in the hospital, but they still have to take precautions. All this bogs down the system. And then you add to this a departure of a net loss of 1,400 nurses. When you just do the math, I can't see how you can fix this immediately in the short term.
It's so disheartening,
Depressing.
And I mean, you read the number, I feel like we're just almost numb to it, like hearing about people spending days upon days on stretchers, or they're kind of like stretchers in the hallways of the ER. And then cardiology, if I understand, cardiology has been accepting some of these patients as well, just to try to make room for them. Is that what we're talking about here?
No. That the example I gave there is that if you needed to be admitted to cardiology, they didn't have the space. Sometimes they don't have the beds, so you have to receive your care in the ER. But one of the things I might as well share with your listeners, newsflash, it's so bad now at the Montreal General they had to close the 17th floor because they for the beds, internal medicine ward, because they're not because of a shortage of nurses. So if you look at the numbers in the ER at the Montreal General, they're going up too.
Wow.
So it's not like just don't go to the Royal Vic, go to another hospital. You're going to find the same problems.
Hope you don't go to any or have to go to any hospital.
Actually, there is one that you could go to, but that would be in September. There's one ER
that's great.
that consistently is not that overcrowded, at least during the daytimes. It's Lachine Hospital. It's a small ER. I think it's just 12 beds. So, and it's not open overnight. But come September, it's going to be open overnight. So some people who and that's part of the reason why the Royal Vic was having a problem, is that some patients who are on the West Island, like in Dorval and Lachine, who should have gone to the Lachine Hospital, they ended up at the Royal Vic at the Glen site in NDG. So, there are, if you look at, Index Santé, Google that, Montreal, and you'll see which ERs are busier than others. What I can say is that the Jewish General, even though it's hit with what I would call a tsunami of patients every day, it's able to move them through the hospital quickly. It's more efficient than some other hospitals. The Royal Vic, it's really, really bad because it can take 7.5 hours from the time you're triaged till the time you're actually examined by a doctor. That's, in my opinion, dangerous. And then, as I said, you can stay in the ER on a stretcher for almost 6 days when you should be on a medical ward with a physiotherapist assisting you, or an occupational therapist, getting the appropriate care, because the ER nurses, that's not their role. Their role is to quickly stabilize the patient, and then get them out to the different wards. And they're not being able to do that because you don't have enough nurses on the other floors.
I can't even begin to imagine how demoralizing this is for the people working in the system, never mind the patients, just the people who find themselves in this situation, who want to help, who want to do something, and just simply can't.
Think about why you go into healthcare,
Wow.
right?
Yes, and that's why one of the sources I spoke to at St. Mary's, they're literally saying a prayer before they start a shift. God, please, let me get to a shift and not have a patient die. I'm not exaggerating when I say this, and that's why I'm focusing so much on this, because it's an extremely serious problem. You'll recall the health minister set up this crisis cell 6 months ago. And we're not really seeing much improvement. It's still going on.